The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And this time, this one is kind of to get you moving, get you active, and also get the synapses firing because it's all about therapy. And I have some wonderful ladies in here from the HSA. Go ahead and introduce yourselves, please.
Hi, good morning. I'm Sarah Caswell. I am a pediatric occupational therapist with the Health Services Authority. I have been with the Health Services Authority for just a little over a year now, but I have been practicing occupational therapy in the Cayman Islands for almost 10 years.
Good morning. My name is Melissa Chavez. I'm one of the pediatric occupational therapists at Health Services Authority as well. I arrived about 6 months ago. I've been there for about 7 months now. And I've been in OT since 2019. And I've just been working in different areas, helping kiddos in all aspects since 2013.
Okay, excellent. So talking about it, most people don't think of therapy until they need it. And so when you walk in, and especially pediatric, because we're talking children, what's the age group that you generally work with?
So our services are actually from birth until about 17 or 18 years of age. So we start intervention as early as the neonatal intensive care unit at the HSA hospital. And then we follow children through infant, toddler, preschool, school age, as well as into high school if necessary.
Wow. Okay. So what's the role of a pediatric occupational therapist? I mean, when you just started talking about literally child development from birth till adulthood, tell me a little bit about that.
Absolutely. So pediatric occupational therapists aim to assist children in developing the necessary skills to perform daily activities such as self-care, play, and school-related tasks. Essentially, we help foster independence with children. And that can kind of look quite different depending on the diagnoses. So in children, OT stimulates and promotes learning for those with learning disabilities or those recuperating from injury or illness. We also help with enhancing academic performance. We look at kind of things like hand-eye coordination, functional skills like eating, writing, eating, writing, dressing. What else do we have? And using the toilet. Mm-hmm. Yes, very important.
And I think for the early years, so again, when we were talking about from birth, a lot of that is about motor development.
Okay.
So we want to look at and make sure that babies are developing the correct movement patterns that are very necessary for developing those higher level skills as they get older. So we start with kind of looking at smaller areas, and if we can address them early enough, then sometimes we can prevent or limit significant challenges later in life.
And when you think about that, I mean, when a child is born, it may take a while to kind of notice that they may have some motor developmental skills outside of something that you already prenatal known. So when do parents come to you? Do doctors refer? How does that work?
I think we use a combination of things. So a lot of our infant referrals will come from going to your wellness check with your pediatrician, and they're looking for certain things. Some of them, so one of our pathways here at the HSA, which I think is fantastic, is we look at kind of being preventative instead of reactive. So if we know that you were born prematurely, there is evidence to show us that there is a likelihood that you could have challenges. So we have a pathway where we'll follow you. So if you were in the neonatal intensive care unit, we start with monthly reviews. And then so you have occupational therapy and physical therapy who review where you are at. And then we'll suggest intervention very early on if necessary.
Mm-hmm, exactly. So you look at also, I guess, the background of the mother and the building up of that also to say, maybe they had some health challenges during the pregnancy that could relate to later on developmental problems.
Right. Exactly. So birth history is very important. The other thing is some of our team is trained in very specific assessments that are just observations. There's a strong evidence base, just looking at babies' movement patterns from when they are born that can predict if there will be challenges or not. So it's a very evidence-based practice.
So as you said, some of the challenges and conditions, I guess, that you are looking for here, is it specific for Cayman, or this is something globally that you work with, or how do you take a look at that?
So I think, although we're a smaller population in the Cayman Islands, we do have a variety of conditions that you see globally. So we do go overseas for a lot of training for these conditions that are seen here. So we treat a variety of genetic conditions, global developmental delays, cerebral palsy, autism spectrum disorder, or anything along those lines. Okay,
so it's really taking a look at it, a very concise look at the child development from an early age. You look really specifically for lack of better words, the 10 top things, and then you kind of break it down from there.
Yeah, and I think early intervention is key. The evidence does show that the earlier you get involved, the better. But there are children that we get referrals at school age, and we can get involved then and still make a significant difference in the child's functioning and their abilities.
Excellent. So do a little change now. What are some of the common challenges that we see here with pediatric occupation therapists working here?
As Sarah mentioned, we do have a lot of autism that we look to support, dyslexia and dysgraphia, cerebral palsy as well, and we have, we even treat prior to diagnoses if we're having a look at, not meeting certain milestones, or if there's just some support needed for, as I mentioned, activities of daily living is what we call them. So things like my child is not eating a lot of foods, or my child is not potty trained and is about to go to school and he's needing support for that, or they are needing support for that. We're looking at things like handwriting as well that don't always necessarily have to come with a diagnosis to be seen by us, essentially.
I just wanted to add to that because I think it brings up a really good point about a large aspect of our role is education and advocacy for children. So, for example, if you have a child who has autism spectrum disorder, maybe they have some sensory processing challenges. So they would be seen in our clinic to come up with strategies to help address those, but then we can help support that transition to preschool. Hey, we found these strategies effective. Try these in preschool so they can successfully function in that environment. We collaborate with parents, educators, and everyone else because we want the child to be successful not only in therapy but in their everyday life.
And I was just about to ask about that because some of the skills that you develop for that child needs to be transitioned to the family and need to be transitioned to the school environment or maybe the caregiver so that you can keep building upon that.
Yes, and I wanted to add like Sarah brought up a really great point about it having to, the education aspect of it, where it's also really important, as you said, to collaborate with all these teams. So it's to be parents, caregivers, teachers, and just to kind of make sure that these strategies that we're implementing in clinic are taken, in through all the environments. So that's really important. And I think a lot of times parents come and see us and they're worried about, how if they're progressing in clinic, are they going to be progressing in school as well? Are they going to be progressing at restaurants? Are they going to be able to eat, a little bit more? All these little different environments that they partake in. And I think that it's really important for us to educate and advocate for the importance of OT because it is also, there's a big educational aspect, and the carryover of our strategies is, first off, our intervention is focused on making sure that these strategies can be carried over and it's kind of used in all their environments.
Excellent. Folks, we're going to take our first break this morning. I hope you have been tuning in and enjoying it. We're talking today about pediatric OT, occupational therapy. We'll be right back. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m., we get together and we talk about all things related to your health. Compliments of our friends over there at HSA. And today we're talking about occupational therapy from a child standpoint, which is pediatric occupational therapy. And we have some specialists here in the building with us. Go ahead and introduce yourselves again.
Good morning. I'm Sarah Caswell, one of the pediatric occupational therapists with HSA.
Hi, and I'm Melissa Chavez, one of the other occupational therapists at HSA.
So we were talking a little bit earlier about the continuation of child development when it comes to occupation therapy and how it's just not in your circle. It has to be built outside to continuation for the benefit of the child.
Exactly. So one of the key things about our role is collaboration. And one of the ways we collaborate is not only with educators or parents and family, is with other healthcare professionals. So we typically work as a part of a very large multidisciplinary team. A lot of our children have speech and language therapists, physiotherapists, and other specialists on the island. So an example of that would be, say I'm working with a child who has limited language. I'm going to go to their speech and language therapist and say, hey, what is the best way for this child to communicate their needs? What strategies are you using? So then I'm going to use those strategies in my session on how to build their communication. Then that's another opportunity, whether it's the parent or the nanny, caregiver, or if I'm at a preschool, for them to see or for us to model those strategies, because our goal is to model as much as possible with what's going to benefit the child.
Yeah. And that's really a great, I guess, circular way of doing it. You know, in the past, there was, okay, so this one did one side and this one did another side. And then you wrote reports now and again, so it's really a well-rounded scenario for the benefit of the child.
Absolutely. And I think one of the terms that we love to use in occupational therapy and also in other services like speech is holistic. You know, we try to have a look at everything from all angles and make sure that it's really encapsulating the a person-centered intervention. And kind of to give an example of what Sarah was saying with schools and and strategies that we use with our fellow speech therapists is, for example, if a speech therapist will be saying, okay, we're starting to introduce like a communication board with a child who might be not speaking but able to communicate their needs by pointing at symbols or pictures with little kind of like descriptions on the bottom, then that could be taken into my sessions where I could be using them to teach them skills that I'm working on, and then I could go to school and communicate that with teachers where they're using, or everybody is using the same symbols to communicate, just to make that quite consistent in their life and to really hone in those skills in every single environment. So that's actually really helpful. I love to use that kind of strategy with my kiddos, but it's so important to kind of keep that communication alive between everybody in the MDT team. And by that I mean parents, caregivers, teachers, and other therapists. But so yeah, it's really good to make sure that communication is always flowing, and I think that HSA does a really good job at that and keeping that as like a priority. So yeah.
As you brought up something I think is really important, the expertise for every age of development, from premature infants to babies to toddlers. You are there and literally have different ways of dealing and communicating, because as a child, I would say as a toddler, it's very limited to how they can communicate outside of pointing, outside of crying and things of that nature. So you start developing from that, so that there's a building block for when they're a toddler and going through those 2s and 3s and things of that nature.
Yeah. Go on.
I was going to say, exactly. And sometimes developing that communication approach requires the collaboration of an occupational therapist. So with your speech therapist, if you have a child with a motor impairment, so say it's not very easy for them to point, how are we going to find a method of communication? Do we make the symbols bigger? Do we build up borders? Do we use something that's more sensitive, that's electronic, high-tech AAC? So we are kind of that access approach. So the speech and language therapist, they have how they're going to do it, and then we will collaborate. And then maybe in their occupational therapy sessions, we're going to work a lot more on visual motor integration skills and fine motor skills, because that's going to help them communicate. So again, it's that holistic approach of what are the priorities for the child at that time.
Understandable. Very, very detailed. So how does this differ from dealing with adults? Because, I mean, we're talking, as you said, from birth till 17. That's a long range and a long time to have these different approaches.
Yeah, I think one of the main differences is in adults, they've already acquired the skills. Whereas in pediatrics, they're still learning those skills. They're learning to clap, they're learning to point, they're learning to walk. They're learning more refined skills of how to use utensils to eat food. So we're there through the developmental process. A lot of development is sequential, so we need to make sure that they have the foundational skills, kind of those building blocks to keep going, and we target those things. Another main difference, I guess, from our framework and our theory is what is considered productivity. Productivity for a child is play. That's how they learn, that's how they experience the world, and so that's how we do therapy. Therapy is play-based. It is evidence-based, we use evidence frameworks, but how we teach it is through play, because that is their world.
And I mean, it's not to say that as occupational therapists, we don't, pediatric occupational therapists, that we don't see like patients kind of and focus on rehab, but it definitely is. There's a bigger focus on, like rehab, because of what Sarah mentioned, because they've already acquired skills and rehabilitating themselves to kind of be able to do those things again. Whereas we, as pediatric therapists, kind of focus on maybe compensation and adapting, and kind of looking at things like, again, productivity, kind of teaching them for the first time, how are we going to do this? Maybe it looks a little bit different than your classmates or than your brother or your sister, but it's definitely going to be something that they're going to be learning for the first time in their own little way.
I think what you tapped into is something I think is very important, learning the correct way, but it's different for them. Because for a child that doesn't need occupational therapy, they're automatically running into it, and they may see that the child who needs it sees them doing it differently and then can't do it. So then it's just frustrating. There's some issues there. So teaching the first way, which is directly related to them only, I think is a great idea and a great way to base it.
And I think Sarah and I could probably sit here and have lots of conversations about a really big part of our job is kind of dealing with those frustrations, is educating families. And I really kind of want to reiterate that OT isn't like there are other therapies where it's so patient focused that it's like, okay, this is I'm only going to see this patient and my treatment's really just going to focus on them. It is so much about educating families and advocating for them, and also educating, other people who are in their lives. Just talking about the importance of keeping everyone in the conversation about how so much of my job is having families come in and be like, there's this frustration because so-and-so isn't writing or isn't eating like so-and-so. And we understand, and as OTs, we're almost professional in understanding that frustration, but also we're here to kind of talk with parents and educate them and be like, it's like, as you said, they're doing it differently, and it's not about comparing, and it's not about getting frustrated. It's just about, so-and-so they're going to be learning things differently, and that's okay.
Right.
Yeah.
A lot of, I guess, for the lack of a better word, information that you provide is basically teaching the child how to maneuver through what they need to do, but also accessing the parents and the caregivers to say, hey, this is going to take a little while different than your previous two children or the school or something. So you need to understand what you're dealing with outside of that. So that's almost a different training.
Yeah,
I agree. And I think a lot we use the term child-centered approach, but I think more of what we do is what we classify as a family-centered approach. It's very family-centered. So, in the majority of my sessions, I have a parent or a caregiver in the room with me, so I can talk through what I'm doing. Why do I want to do it this way? How is this going to help their child? And then they can ask questions. A lot of times I like to get parents involved if we're working on, say, a transition from lying to sitting. Come, let's practice together so that you feel comfortable practicing this at home. We want to empower parents and caregivers to advocate for their children for their specific needs.
Yeah, and that's a great thing that you brought up, because it is about giving the parent the confidence to go home and do it themselves and not have that to rely of the only way that I can help my child is having them directly seen by a therapist. It's like I'm now equipped with the strategies because we had that training and that time with the therapist.
Right, exactly. It becomes a very, as you said, holistic approach to it, that all vested interests from mom, dad, from caregiver, school are approaching it the same. So the child is always in the kind of the same mindset,
right,
no matter where they are. I think that's a great look and a great approach to it.
And it's not only, a great approach. I feel like it's so important to understand that is, especially for children who thrive in routine and consistency, this is what's going to work. And it's something that parents, that we try to discuss with parents, the importance, how highly important that is to make sure that, the teacher is incorporating these things in the classroom, and that is how important it is to be incorporating it at home as well. And just kind of, again, giving them that routine, that consistency that will really, really support the strategies, I guess.
Exactly.
Yeah, I think a lot of people, when they think of pediatric occupational therapy, they think, okay, I'm going to take my child to their session, they're going to see a therapist, and it's going to be over. But what they don't realize is an equally important part of our job is taking our evidence base and our clinical reasoning and our clinical judgment and then translating that into empowering the parent. So it's equally as important as that direct, whether it be hands-on physical intervention that we are doing with the child, is that piece for the parent and the caregivers. And I think it's absolutely fantastic when you see a parent get it for the first time and then and they come back and be like, hey, we worked on this so hard, and you can see it in the child. They can't make it up, because I will tell by looking at the child either you've been doing this or you haven't been doing it. We will know.
Exactly. Absolutely. It's so true. Definitely. Folks, we're going to take another break and come right back. We're talking today with our HSA experts with pediatric occupational therapy, and they touched on the importance of play in therapy sessions. When we come back, we'll explore this idea just a little bit more. Keep right here. My name is Chuck Taylor, and this is Healthcare Today with the HSA. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Thank you. Each and every Friday and Saturday, we get together and talk about all things related to your health. And this time, we're talking for our kiddos out there, the pediatric occupational therapist in the building with us. And before we left, we talked about the importance of play as part of the therapy session, and also building upon that. And you made an interesting, I want to say synopsis. Tell me about that.
So we were just chatting on the break about how, as a pediatric therapist, play is our world. That is our avenue to access children, to motivate them, to engage them, and to get them to work on those clinical skills that we really want. I was saying, my trunk is full of toys. I always have toys. I hear a lot, do you just play for a living? Absolutely not. But in other words, absolutely yes. Because if I want to work on, say, a visual motor integration skill, hand-eye coordination, so we're going to work on that through putting shapes in a shape sorter. I've got lots of great shape sorters. They light up, they make noise. And so you, as an observer, it may just look like, oh, they're just putting the circles and the squares. But really, I'm working on that really crucial skill of hand-eye coordination, of motor planning, of all of these skills. But the child is having a great time. They're laughing, they're smiling. We adapt. We follow the child's lead. If they see something else that catches their eye that we can quickly pivot to and that'll work on the same skill, then we're going to follow their lead. We want them to enjoy as much as possible everything that they're doing.
Yeah. Exactly. So it's not really for the child, I got to go to work. It's, hey, I'm going to have a great time and I'm learning. They don't see it as learning, but you really tailor it for that reason to make it don't seem like it's a stressful situation. They can't get it in and they're fighting, and it's fun. As you said, what you think about is so specific to what the child needs that it becomes fun, and then they translate it to every day.
Absolutely. And kind of what Sarah was saying about the toys and the trunks, if anybody out in the outside world were to look into my car, be like, what exactly do you do for a living? And it's just like there's plush toys and there's puzzles and there's things. And I think, there is a lot of aspects. A lot of my life is about play, but it's like the amount of effort and thought that goes into every toy that I buy. And it's just like, okay, they could use this for like their finger dexterity or for in-hand manipulation, or, and this will be so good for my so-and-so patient because I know that like they really like the color purple, and they also really they really need to work on like learning on their pinching grasp. So yes, from outside, parents and other children, they're having a blast because they're like, oh, you guys get to play for about 45 minutes. But I'm like, the amount, first of all, the amount of thought that went into every single game, and anybody who works with children would be fully aware of the fact that children do not always sit still for very long, and their interest waves or waver quite easily. So it's about also, as occupational therapists, being really good on our feet and being like, right, okay, that toy didn't work, or this game didn't work, let's kind of find a way to maybe use the toy in a different game, or pull out another toy from my hat, and it's that constant involvement of like, okay, we're gonna jump here. That's why we have so many toys in our trunks, and that's why we that's actually so refreshing to hear, and
because opportunities for kids to explore and learn and develop skills is part of their building block naturally. So the fact that you are incorporating what they're naturally looking to do in a more specific way, as building the dexterity, building the connection, the game pattern, and also just understanding how to sit still, because at any age, any child, even a child with non-challenging, it's hard for them to sit still. So imagine a child that has challenges. That's even double and triple what you got to go through. So I totally get what you're looking for. You talked about some of the strategies. Give me a few of them that you can use to, I know I'm putting you on the spot. Imagine, let's just say, supporting a child with sensory processing difficulties. I know that's a big word, and I actually had to look it up a bit, but tell me some of the strategies that you could use for something of that nature.
I'll touch on a couple, and I think I'll definitely have a chat about sensory strategies. But also, I feel like there might be a lot of people listening in the audience who are having maybe trouble with training their child how to use the toilet. So I think those might be some two big ones out there that everybody might want to get some help with. Sensory strategies, definitely, we're looking at, and again, as we've spoken a lot about during this conversation, is that we try to keep things child-centered, family-centered, and come up with an intervention that is very exclusive to the person that we're seeing. So especially with sensory difficulties, every child's different. I mean, there are senses that we look at, the senses that we're familiar with, as well as one that is called vestibular and proprioceptive, which kind of looks at movement and balance. So those are kind of senses that we, apart from the big five, but we also, in terms of strategies. So some of the sensory strategies that we can use for children who are struggling, depending, just to give an example, let's say they seek auditory stimulation. So we're looking at children who love listening to music, or or they'll make vocalizations, or they'll be screaming and kind of seeking those kind of like big, like those toys with lots of noises and things like that. So as therapists, we might be able to offer them, okay, like, why don't we have some headphones on when they're working with like music, and that could kind of like keep them a bit focused for a little bit more. Or if we're looking at a child who's always swinging, or like a big busybody, as they like to call them, or just want to be walking around all the time, okay, what is it that they need? And then we'll go through some of these strategies of like, okay, what if we provide them a little bit of more movement before our session? And if that's kind of working to support them to like stay seated, maybe we can talk about giving them something to like, maybe like a wiggly chair, is that what they're called? Like a wobble chair? A wobble cushion? Yeah, like a wobble cushion, or providing them some movement breaks at school. If, again, it's very centered to the child.
Very specific
to each child, but there is definitely some sensory strategies depending on what we observe in session. And okay, so maybe they're seeking movement, maybe they're seeking lights, maybe they're seeking a bit of more pressure. A lot of children love a bit of getting some pressure done on them before sessions, and that really helps them focus. Okay. But these are kinds of things that maybe you would observe in your child, or that it would be kind of, actually I'm just gonna leave it there, because I'm gonna keep going. This is my wheelhouse, so I'm just gonna stop. You can edit that out.
Excellent. As we have been talking about this, some real success stories have basically been kind of that self-care skill, where a child is confident enough to walk in, pick up a toy, and start moving on their own, because they've done it enough with you that they're very confident about building on their own. Do you see that and you say, okay, you know what, I'm going to let them see where they go and follow suit with that?
Very much so. I think in the beginning, especially in the beginning, building rapport is very key. So if I'm seeing a child maybe the first time, the second time, I'll put out a few different toys that I know will target the skills that I want to look at, and I will watch and see what they do. I very much follow their lead. I think active initiation and engagement is the best form of intervention. So we do that quite a bit, actually. So you will see that your child walks in and we let them choose things, but like Melly has mentioned, everything is very specifically chosen. And that's one of the best things for us. If we see a child who we've been working on a visual motor integration skill for a few sessions and they come in and they see a toy and they start interacting with it functionally, that's amazing for us. That is a huge win, and we love to see those moments.
Very true. We're going to take our third break, folks. We'll be right back in just a few minutes. And don't forget, we want to talk a little bit about Occupational Therapy Month, which just happens to be the month of April. We'll be back in 2 minutes, and I'll ask the ladies to give me a little bit more insight on that.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And this episode, we're talking about pediatric occupational therapy with the ladies here. Ladies, introduce yourselves one more time for our listening public.
Hi, I'm Sarah Caswell. I'm a pediatric occupational therapist with HSA.
Hi, I'm Melissa Chavez. I'm one of the other occupational therapists for HSA.
So we rolling into the month of April, which just happens to coincide with Occupational Therapy Month. Tell me a little bit about the celebration that you folks are doing over there at the HSA.
So for Occupational Therapy Month, we like to kind of advocate and educate people and bring awareness to the profession of occupational therapy. I think even today, it's one of the lesser known professions out there, and we really want people to be aware of the impact that occupational therapy can have on getting a child to their fullest potential, and all of those things. We also like to celebrate our colleagues and all of the hard work that they do throughout the month. So I think the There is a Cayman Islands Occupational Therapy Association on island, and we actually had a social last night to kind of celebrate Occupational Therapy Month, do some networking and get to know each other, which was a really fantastic event, and we plan to do some more things in the future for awareness.
Definitely. Yeah. And we talked also about breaking down the specialized fields that you folks are doing over there. Tell me a little bit about some of those.
So recently, the occupational therapy team at HSA has grown significantly. We are a team of 5 occupational therapists now, and we all bring a lot of very specialized services to our clinical practice. So we use different frameworks from what we call NDT, so neurodevelopmental therapy. We also offer DMI therapy, so that's dynamic movement intervention. We also have SOS feeding, so your feeding course for your picky eaters, handwriting without tears to help with handwriting, as well as other very specialized training courses such as sensory integration to help with sensory processing for a lot of our children with autism spectrum disorder or children who just have some sensory processing disorders that do not have a diagnosis. We're also specialized in things like the Prechtel General Movement Assessment. So those are just some of the specialized things that we offer at the HSA.
Yeah, I guess going back to kind of start from the top from where Sarah was, as she said, April is OT month. So we're doing a lot to celebrate on the island. I know that it includes a lot of baking and celebrating each other for, as she said, this is a big team for us this year, so we really want to celebrate all of our strengths that we've brought in. I think each one of us brings something that we love particularly and have specialized in. I personally love to rant about sensory processing. Also have a lot of experience with children with autism. I myself have ADHD, so I love working with kiddos with ADHD to support their productivity. So I find that fascinating. And there's other gals on our team who love to work with older kids. Mm-hmm. I'm actually one of the ones who love to support children transitioning between high school and college. Is that how you call it on the island?
Mm-hmm, yes.
So I do a lot of work with the 16, 17-year-olds. Okay. That's kind of what I particularly really like. But, some girls really like working with babies. Mm-hmm. So I think not only is April, celebrating all of the OTs on the island, I just really love to celebrate us because we've done such a good job at building a team that is really good at all the developmental stages.
Yes. Excellent. So anyone listening right now, and they're, at that point, maybe they just moved to the island and they need some help. How can they reach out to you good folks over there at the Pediatric Occupational Therapy at the HSA? How can they do that?
So if you're wanting some just general information, we have a general email address. It's occupationaltherapy@hsa.ky. Or you can call our therapy services department, 244-7675. That can get you some general information. If you are wanting an assessment, then we do require a referral from your pediatrician. So whoever your child's primary pediatrician is, they will write a referral, and that can come to us in various ways. They can send the referral to that email address. Mm-hmm. Once the parent has a copy of the referral, they can call and say, hey, I have a referral. Then they'll get booked in for an assessment and then bring that referral with them. And then that assessment is really where it kind of starts. So it depends on the reason for the referral, but a typical assessment is going to look like an observation. We're going to watch what your child is doing so we can get an idea. We're going to do what we call a parent interview. We're going to ask you, what are your concerns? What brought you here today? Mm-hmm. And really try to understand what the parent is finding challenging. And then we're going to ask our questions because there are certain areas of development that we want to look at. And then sometimes we may go on to do a standardized assessment that'll look at things in more detail. And then when that's complete, we sit down again with the family and we build a plan that works for that family. Where is your therapy going to take place? Is it going to be in the clinic? Is it going to be in the community? Is it going to be in their preschool? What is best going to meet the child's needs? What is the frequency of therapy? Who else do we recommend that gets involved and becomes part of your child's team?
This is pretty intense. You work outside of the HSA in preschools and homes and stuff also?
Oh, yeah.
We do. We do have some families, for example, who are at work during our working hours, and say the child's caregiver doesn't have transportation. Each of us do have community days. We go out into all of the communities, including the eastern and northern districts. So we do our best to meet the child and kind of where they're at. Sometimes a child will come in and they can do all of their skills in the clinic setting, but where they're having challenges is the school setting.
Yeah.
So we'll
That's what I
liaise
was
and
gonna-
collaborate with the school and plan to go into that setting. Or maybe it's an older child and you're working on some activities of daily living and that's best done in their home. Again, we'll go into your home and help you there.
Yeah, and sometimes, we're going into homes because the main concern is, my child's really, really adverse to trying new foods. Anytime I try to give him something, it's a screaming, a crying, a tantrum. So, in those cases, it's best to work in that environment. So, okay, let's go into the kitchen. Let's whip up something. Let's see where and start exploring foods in that setting where the child will be experiencing, trying new food. So that's kind of like having a think about how to provide intervention in a way that's going to work the best also as well. So sometimes it's, as Sarah said, going to school and saying, we're going to be learning how to use the potty at school because that's where you're having the issue. We're not going to try and practice that in the clinic if that's not going to be a transferable skill at school. That makes
Understandable.
sense. Yeah.
Understandable. All right, folks, we're going to take a final break, and when I come back, I'm going to ask the ladies to wrap up. You're listening to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We have with us our occupation therapist from the HSA, and just talking about and celebrating all the things that they do. Plus, this month, the month of April, is Occupation Therapy Month. And we were just talking about the roles that occupation therapists have in helping, especially our pediatric, our kiddos, our kids. And wrapping up, tell me one final story.
Sure. Thank you. So one of the things that we do at HSA that I am particularly involved in is prescribing complex specialized equipment. So what that looks like is maybe your child needs a wheelchair, but it's not a wheelchair that you would think of when you see someone being pushed in the hospital that we refer to as a transport chair. Maybe they have, they have weakness, they can't sit independently, or they have challenges with head control. There's varying levels, but we try to start prescribing equipment when, if a typical child would be walking by this age and they're not walking, what is their mobility going to look like? Because we still want them to explore and experience the world. And I think one of my most memorable moments is, I'd never done it before. I think at the time, my youngest client I had successfully in a self-propelled wheelchair was 3. But I had a little girl who was 1.5 years. She was working so hard in therapy, but at this point, all she was able to do independently was roll. So she could get across the room by rolling 5 or 6 times. But it's a bit different, and I wanted her to experience her world. And so working very closely with her family and through donations, she was prescribed a wheelchair. I went in, I did some modifications, and we set it up to meet her needs. And watching a child propel a wheelchair at 1.5 years across a room for the first time was one of the most incredible things I have ever seen. There is a smile on a child's face when they are able to move for the first time independently that is like nothing in this world. And I think that's what brings me the most joy, and what I celebrate as being an occupational therapist is being able to be a part of giving these children these moments. And it's absolutely fantastic.
Yeah, and I agree with Sarah, because I think one of my moment also is, and as an occupational therapist, our whole goal is to increase independence, and seeing that work and seeing that gained and being able to see it, from start to finish is not only obviously memorable for me, but it's just one of those moments that it's almost you've granted someone freedom. Mm-hmm. You've granted someone the ability to be autonomous, the ability to feel like they don't really need to depend on someone. Mm-hmm. The magic and the beauty of equipment sometimes doesn't only benefit the client or the patient that we're seeing, but also the families. And I think that's one of my most memorable moments was we were helping a mom. She was a single mom, and she was having a hard time during feeding time because her baby had to have a bilateral amputation. So she wasn't getting support from family. It was just her and the baby. And mom was like, I can't turn around for a second because I need someone to feed the child. He's struggling with mobilizing and all these things. But my most important, she's like, my biggest concern is just getting him fed, obviously, because he cannot feed himself. Mm-hmm. And this child, and we tried several different things, because equipment unfortunately can be quite expensive, but through donations as well, and through just so much advocating and really pushing through, we were able to acquire this piece of equipment, and then spent weeks adapting it and making it so that this baby could navigate it independently. And seeing them, and that little electronic spoon that he pressed and made move, and seeing them feed themselves for the first time was by far one of the most rewarding things and days of my life. And not just because I saw them doing it independently, but also the look of mom's eyes and relief of this is now independence that I've gained myself, because my child has increased their independence. So love that.
Ladies, thank you so much for doing what you do. Continue on and celebrate with us Occupational Therapy Month. Thank you so much, ladies, for stopping by here.
Thank you for having us.
Keep right here. This is Healthcare Today with the HSA. We'll see you next week.